Everybody, this is Dr. Johnson of Johnson Chiropractic and Rehabilitation here in Catonsville. In our previous video, I gave you a brief description of what a pinched nerve is. The question now is, how do we know that maybe you are suffering with a pinched nerve? So when a patient comes in, obviously we do a complete consultation. We'll ask questions. What's wrong? How long have you had it for? Where does it impact your life? And until we do those questions, we can understand whether you have a pinched nerve or not. For most people, there's a lot of nerve pressure, nerve irritation, either the neck or lower part of the back, again, causing pain, numbness and tingling on the arms, hand, fingers, or down the leg, feet, and toes. If it's in the neck and arm, some people call it like carpal tunnel symptoms. If it's in the low back or hip, they may think they have a sciatic nerve problem, or they have a herniated disc or bulging disc of some sort. And all those things can contribute to causing the pain and symptoms of a pinched nerve. But the most important thing I find is really just sitting, talking with my patients, asking them questions. And usually after I get through all the questions and case history, I have a pretty good impression of whether they're having the pinched nerve or not before we even get into the examination, and typically x-rays or MRI to really give me further information. But the case history is so important. When you come in, whether you see myself or any provider, really giving a good case history and letting the doctor ask you questions to make sure that they're getting what they need. But if you don't feel like you're getting enough out, make sure you state really what's going on as well. So whether it's myself or the other different provider knows what's really bothering you. So really, I find the case history being so important to really help give me a good baseline to establish a good diagnosis, along with other tools as well. But if you're having a pinched nerve, make sure you call us, give us a call. Let's see what we can do to help you get relief from this problem, so you don't need to suffer needlessly with this pinched nerve. In our next video, we'll talk about examination and imaging. And in a final video, we'll talk about treatment. I'm Dr. Johnson of Johnson Chiropractic and Rehabilitation here in Catonsville, helping you get relief from a pinched nerve.